Welcome to the Policy Visibility Drive, a Ghana Health Service policy initiative created to enhance the exposure of policies, manuals, and guidelines within the health sector. In this video, we shall be focusing on the National Policy and Guidelines for Infection Prevention and Control in Healthcare Settings. A robust infection prevention and control program is essential for healthcare quality, offering the potential to reduce the disease burden on patients, institutions, and the nation. Over the last 2 decades, healthcare-associated infections have posed significant challenges in terms of quality and cost. Consequently, many healthcare organizations are working to enhance infection prevention and control. The National IPC Policy and Guidelines, first introduced in 2003 and revised in 2009, faced challenges in implementation due to inadequate dissemination and insufficient support efforts. Recognizing deficiencies, a review of these documents was deemed necessary. The IPC Policy and Guidelines aim to guide healthcare personnel and clients in preventing and controlling infections within healthcare settings, ensuring patient safety and health worker protection. Non-compliance with the policy may lead to increased morbidity and mortality, potential litigation against the Ministry of Health, healthcare facilities, or individual health workers, disciplinary action by professional counsels for proven negligence, causing harm to patients, loss of public confidence, revenue, and non-accreditation by the National Health Insurance Authority. At the national level, the Ministry of Health has the ultimate responsibility and authority for ensuring the availability and use of infection prevention and control policies and guidelines. This is achieved through the National Infection Prevention and Control Program, which is managed by a designated program manager located in the Institutional Care Division of the Ghana Health Service. At the regional and district levels, designated individuals oversee the implementation of the IPC program and work with IPC teams to integrate facility-based infection prevention and control programs with other relevant programs. Additionally, community representatives such as community volunteers, NGOs, and CBOs have roles to play in IPC activities under the supervision of the sub-district head. An IPC program is a set of coordinated activities that aim to reduce the risk of infections among healthcare workers, patients, visitors, and communities in healthcare settings. The main activities of the program include practicing basic IPC measures, educating and training healthcare workers, educating patients and their relatives about IPC, protecting healthcare workers, identifying and minimizing risks, using antibiotics rationally, following effective work practices and procedures, conducting surveillance, investigating incidents and outbreaks, advocating and mobilizing resources, and conducting research. All healthcare facilities should prioritize their infection prevention and control needs and design their programs accordingly. Understanding the infectious disease process is crucial for grasping infection spread in healthcare facilities involving 3 elements: a source of infecting organisms, a susceptible host, and a means of transmission. In healthcare settings, microorganisms are transmitted through various routes, with a single microorganism potentially transmitted via multiple routes. The primary modes of transmission include contact, droplet, airborne, common vehicle, and vector-borne. Fundamental for basic infection prevention and control are grounded in the principle that all bodily fluids, secretions, excretions, non-intact skin, and mucous membranes may carry transmissible infectious agents. When standard precautions alone don't fully interrupt transmission routes, transmission-based precautions, categorized into contact, droplet, and airborne precautions, are utilized. These precautions, whether used alone or in combination, supplement standard precautions in patient care settings.
If you've liked this video so far, give it a thumbs up and subscribe to the official YouTube channel of the Ghana Health Service. Comment down below as well to let us know what you think, and click the card above to view all Policy Visibility Drive videos.
Hand hygiene encompasses various methods such as routine hand washing, antiseptic hand wash, antiseptic hand rub, or surgical hand antisepsis, and is crucial in preventing the transmission of infections. To enhance the effectiveness of hand hygiene, it is recommended to maintain intact skin, natural nails, and bare forearms while covering any breached skin with a waterproof film dressing. Personal protective equipment or barrier protection items are utilized to prevent direct contact between healthcare professionals, patients, and the community with blood, body fluids, and other potentially infectious materials, and there are various types of PPE depending on the task and expected exposure. These include gloves, gowns, masks, face shields, goggles, headgear, helmets, leg protection such as boots and rubber aprons, among others. Patient placement involves placing patients with infectious diseases in single patient rooms when available, or in the same room with patients who have similar diseases. Patient placement should be determined based on factors such as the route of transmission, risk factors for transmission and adverse outcomes, availability of single patient rooms, and options for room sharing. When transporting patients with infectious diseases, precautionary procedures specific to their infection should be followed, such as using surgical masks for patients with infectious respiratory diseases. Staff transporting the patient should wear appropriate personal protective equipment, and the receiving department or institution should be notified. The risk of infection transmission through instruments depends on microorganism presence, their number, virulence, and the procedure type. Instruments are classified as critical, semi-critical, or non-critical based on usage sites. Staff handling instruments face high infection risk and must take precautions, as infections can result from exposure to blood, needle injuries, or fluid splashes on mucous membranes. Processing linen consists of all the steps required to collect, transport, sort, launder, store, and deliver clean linen for client care. Healthcare facilities may launder their soiled or dirty linen in-house or contract it out to companies that have specialized in this work. Food and drinks shall be handled in a manner that shall prevent contamination and infections. Storage of food and drinks should conform to standards set by the catering unit of the Ghana Health Service and the Ministry of Health. Appropriate handling and disposal of sharps should be of utmost concern to managers of health facilities. Caution must therefore be exercised when handling used needles, syringes, and other sharps like scalpels, blades, scissors, lancets, broken glass, etc. The guidelines for safe injection practices aim to ensure the safety of injections. This includes performing hand hygiene, adhering to medication storage and expiration guidelines, and using aseptic techniques to prevent contamination. Single-use disposable syringes and needles are recommended, and they should be discarded immediately after use in a sharps container. Medications from single-dose vials should not be administered to multiple patients. For reconstitution, sterile syringes, needles, and diluents should be used, and proper labeling with essential information is required. Multi-dose vials should be discarded if compromised, expired, or without antimicrobial preservatives within 24 hours of opening. Additionally, precautions such as patient prompting, proper client preparation, and the use of PPE are emphasized during injections, especially for procedures involving catheters or injections into spinal or epidural spaces. Healthcare waste includes all solid and liquid waste. Management of clinical and related waste shall conform to the healthcare waste management policy of the Ministry of Health. Key general guidelines include the necessity for personnel to be informed and trained on chemical and biological hazards, restricted access to authorized individuals, proper laboratory cleanliness, and the use of protective clothing. The guidelines emphasize the use of gloves, proper hand washing, and disinfection of work surfaces. Procedures are outlined for the handling and disposal of needles, contaminated materials, and spillages. Hazard warning signs, written spillage procedures, and reporting mechanisms for incidents are also highlighted. Asepsis literally means means without germs. An aseptic technique refers to practices that help reduce the risk of post-procedure infections in patients/clients by decreasing the likelihood of germs entering the body during clinical procedures. Aseptic technique also reduces the service provider's risk of exposure to potentially infectious blood and blood products, other body fluids, and tissues during clinical procedures. The transmission of deadly infectious diseases resulting from mortuary care sometimes occurs among healthcare workers. In handling dead bodies, all healthcare workers shall adhere to standard precautions at all times, and appropriate PPE shall be used. Training shall be organized for all people, including mortuary staff and undertakers who handle dead bodies. This policy is subject to review every 5 years.
Please note, this video only contains an abridged version of the policy document or publication. To access the full document or for further reading, kindly visit the Ghana Health Service website at www.ghs.gov.gh. Thank you for your time and attention.